right. Let's go ahead and call this meeting to order. South Bay City Council of Government Board of Directors meeting for September 22nd, 2022. We verify the quorum and votes needed for action.
Okay, we have a quorum and votes action is, okay, our quorum is fine, but votes needed for action is, I don't know how many people are here. Let me figure this out. I can't do it.
And I had asked Jackie to do this number so that if we do take votes and it is close, we know what a true yes vote is. So
We
let's give
have
a second.
7, 8, 9. We have 9 people here. I count 9, don't you, David? So that means we need 5 plus 1, we need 6.
Okay, and if other people show up, that number changes
It's here, right?
before we take a vote. So we'll just make sure that we monitor that if we're going to take any votes that are close.
There's 13 of us, 13 board members altogether.
How could there be 13 board?
We've got 6, we've got Bernadette,
Oh, Bernadette's here. I'm
Yeah.
sorry.
Bernadette,
There's
Cedric,
already more.
Hildy,
Yeah, I've got here. So
Jennifer, Jim Roos,
8, 9,
and
10,
Stacy.
11.
That's 6 online.
Oh, I don't have Stacy.
We got 6 online
I have 12. That's 12.
and 7 here, right? 1, 2, 3, 4, 5, 6, 7. So that's 13. So the vote total needed
That's a good turnout.
is
But
8.
7, yeah, 7 would be majority and plus 1 would be 8.
8, yeah. Okay, great. Okay, thank you for that. And did we post the agenda?
Mhm.
Okay, great.
Uh,
Do we need to do this declaration on the Brown Act?
Yes, you need a vote every time.
Okay, very good. Is there a motion on the Brown Act declaration, item 4? Moved and seconded. Reverse roll call, please.
Any opposition? Any abstentions? Okay, thank you.
Okay.
Mr. Chair, is it
Yes.
possible for you to share out the board members who are present in person for the edification of those who are online and can't see everyone in person? Is that possible?
Sure. Do you want us to just make quick introductions?
Yes, please. Thank you.
Okay, so I'm Chair John Cruikshank, Rancho Palos Verdes.
B. Derringer, council member, Rolling Hills.
Aurelio Matucci, council member, City of Torrance.
Olivia Valentine, council member, Hawthorne.
Barry White from the city of Lomita, which is in California.
Bronson Chu, Senior Project Manager for Homeless Services.
Britt Huff, Mayor Pro Tem, City of Rolling Hills Estates.
Rodney Tanaka, City Council Member, City Guardian, at second vice.
David Lejeune with the COG.
And Jackie Bagraff with the club.
All right.
And then on the, if I don't call your name, why don't I do this? Hildy Stern from from Manhattan Beach, Cedric Hicks from Carson, Jennifer Lamarque from District 4, and Stacy Armato from Hermosa Beach, and Bernadette Suarez. Okay.
You also have Jim Roos as well.
Oh, right, and Jim Roos. Oh, that's where the, okay, that's where we're getting on. Thank you.
Okay, very good. Next item.
Next item is the announcements of changes. There are no changes to the agenda. And then it would be public comment.
Is there any public comment?
There is no public comment at this time.
Oh, wait, Jeff's raising his hand. Mr. Kiernan.
Yeah, I apologize. I didn't get a chance to put together a report for this month. I think I sort of in my head had it that this meeting was going to be next week instead of this week. And I was off on Monday, so I missed the deadline. I am going to put in a couple links into the chat, some late breaking news that Governor Newsom has signed AB 2097, the Freedman bill that allows parking zero parking requirements within half mile of transit. And other than that, I just wanted to remind everyone that policy committee applications for Cal Cities are open and the deadline is a week from tomorrow, so Friday the 30th.
Okay, thank you, Jeff. I don't see anyone else. Next item, please.
The next item is the consent calendar.
And I'd like to ask to move item B, as in B, from the consent calendar for further discussion.
Any other items to be removed from consent calendar?
Motion to approve the consent calendar, minusing the ones being pulled.
Second.
And moved and seconded consent calendar without item B. Reverse roll call, please.
Any opposition? Any abstentions? Okay, thank you.
Let me make a quick statement too on the consent calendar. We just approved the city attendance, which I very much appreciate. And of course, I would say let's even encourage more participation from our city staff, from all of our city staffs, because there's so many critical items out there that getting as much participation as possible on all these different subcommittees is super important. So anyhow, that's my quick 2 cents on that. Next item.
The pulled item is
Okay.
the revised job descriptions.
Okay, we'll be discussing item B. Who can lead that?
Well, we
discussion?
I pulled it, so I'll start. Okay.
Oh, okay. And I didn't know if there was any information that staff wanted to show or.
We've already done this steering, so we'll find out what these.
Okay, but there is an attachment.
Yes.
So it's, if you look in your agenda packet, it is what, pages 11 through 38. B, you have the floor.
Yes. The reason I pulled this is to ask for it to be tabled until we have more information and a presentation of what is to be done regarding the independent contractor conversion to employees and an indication of what positions and salary ranges would be for those current independent contractors. The reason being is that until this particular agenda item, we were not given actually a staff name and a new position that was provided to us in our packet for September 22nd. However, earlier on our packet for April 28th, 2022, we were asked to approve generically some positions and changing the proposed ranges for the salary positions, partly based on SB3, but SB3 only affects the bottom of the range. It does not affect the top of the range. And it appears that there's some issues here that I'm concerned about because we now, I think Kim Fuentes has been acting as a deputy executive director. We know Jackie is our executive director, but here in this particular item, they're indicating that the deputy executive director would be Marnie Ruland. And the starting salary for a deputy executive director per the attachment we had for the April 28th meeting, which those of you want to look at it, it was pages 55 through 58 of the April 28, 2022 meeting. I think I have been saying all along that I think all of this should be put together in one agenda with all of the information so we can consider it as a whole, because if it's going to affect the contribution that each of us have to make from our cities regarding dues, we need to know what the big picture is for the total salaries and what's being proposed. It appears that there was, for example, based on the accountants or the positions for positions that are being proposed in this agenda, we do not have an accountant, even though we did approve a position for an accountant, which would, it was a top of 81,000, and then the proposed would be a top of 85,000. But instead we have Laura Gerges, who's serving as administrative officer, who is serving to do some accountant responsibilities, but that position has a proposed range per the April agenda of 95,000 bottom up to 130,000, as opposed to the top of 85,000 count. So there's some issues here that I think should be addressed in total so that we see what the total monetary picture will be for the COG, and then what our contribution is going to be asked to make, because my city being the smallest city, I have to be a good financial guardian of my city's resources to be able to know, because a lot of this could be adjusted, because basically the job descriptions will dictate what the proposed salary will be based, and it's not really clear that the proposed salary that we approved in April.
Yeah, there's so much we need to
please.
respond to. And Kim, please add in anything I don't say. First of all, in April, we had to change the salaries because of the law. It didn't just affect the lowest people, it bumped up, you know, when you raise the lower people, you have to also look at the others. We also looked at competitive ranges in April, and our salaries are fairly competitive as it is. And we also don't give the kind of benefits we get anywhere else. So recruiting is difficult. So that was a completely separate thing that we did because of the law, and we hadn't raised our ranges for a very long time. Now what we're talking about is job descriptions, which we have not changed for a very long time. When we have a job description, it doesn't mean we fill that job. For example, we might want to get an accountant at some point, but we're asking Laura to do both administrative officer job and do the accounting. So we don't have an accountant, and that's okay. Just because we have a job description doesn't mean we have somebody filling that job. Also, Marnie, and also we could have multiple people. So for example, Kim is the deputy executive director, but when we hired Marnie, because we had a problem in our accounting, Marnie is a highly skilled, hired employee from Redondo Beach who came in part-time to work for us to get us over a gap. And we are paying her commensurate with what a deputy executive director would get, which is commensurate with her skills. She's only a temporary employee at this point. So you threw in a lot of stuff there, B, but I think that, if you table this, then you have no current job descriptions. I mean, it has nothing really to do with what you're going to pay, which is your dues, which is a whole other conversation we're going to have. And Kim, I would ask you to fill in anything I'm not saying.
Yeah, I would just say a couple of things that the salaries are approved when you approve your budget. So so when you're approving your budget every year, we are looking at what the staffing is, we're looking at what our revenue is, and we're looking at what we need in order to deliver programs to the South Bay, which then drives what the staff that we need, and that's included in the budget. If we lost contracts, for example, that number would go down, and all of that work is done through your budget process. So what we did is, as Jackie said, is that we had to establish new ranges because we lost an entire entry-level position. And so that was a chain reaction. And so we did comps, and then we created the salary ranges, and we changed the job titles because our organization has changed significantly. Those titles were done like pre-2014. And we were focused on like Measure R and Measure M and doing outreach, not any of the other things that we're doing, like Bronson, for example, who's doing homeless services. Then the other thing is then the positions that you have before you are drafted not based on the salary. The positions are drafted based on the needs of the organization. What positions do we need to support the organization, and what position and what skill sets do we need to deliver programs? And so then those are drafted, and those were comparable. We looked at also comparable descriptions so that we made sure that we weren't asking like an admin to do like analytical work or something. So we stayed within what was appropriate. And the last thing I would just say is that I think the Marnie example really highlights what the issue was. We were so bad in our salary levels that we couldn't even have a position other than a deputy executive director to pay her to work for the organization. So I think that is a good example of that.
Thank you, Kim. Bernadette has a comment or question.
I just had some questions that specifically for me, I needed more information with regards to, the descriptions and the contract that we currently have. And I believe there were some questions that I kind of wanted to get some more information as far as the organization and the direction we're taking, and kind of consult with the legal. I just had some questions. So I myself am not comfortable with some of the positions and the job descriptions. And I was hoping we were going to have a closed session on some of these maybe not specific to this, but that would help me understand the job descriptions and whatnot. So for me, I would need more information before approving this.
Thank you. Any other comments, questions? Yes, Barry.
We have spent a lot of time on this, and it is a many-part process. But I have to agree with staff that the next step is to create job descriptions. And, yes, things will flow from that, but, it's not like you automatically have a salary based on particular job descriptions. So it's time for us to move forward on this.
Is that a motion?
It is a motion.
Well, you can still talk on a motion if he wants to make a motion. Do that, and then we can discuss that.
I'll second it.
Make that motion. Okay, moved and seconded.
Okay, I just wanted to say that to the extent that SB3 was obviously a law that we had to work around, it does not, I got my opinion from the city attorney, BBK, that it does not affect the top range. So there's an example where, for example, the top range was reduced from what it was for the senior project managers. We have 5 of those at the COG. The top range had been $99,000. It was reduced to $92,400. And in the April meeting, 2 new positions were created so that if somebody is to promote a higher than for a senior project manager, now they are limited to the $92,400. So they'd have to jump up to either program manager, which starts at $102,400 up to $112,400, or to senior program manager, which starts at $112,400 up to $122,400. All I'm saying is that all of this adds up, and I need to know, this is something we were told that we were going to get the full picture about what was going on with the independent contractor positions, what the job descriptions would be, and the salary levels for them. We don't have that. And I don't think that getting the salaries that were designed were done by Kim. I understand Kim Fuentes took organizations and she picked the San Gabriel Valley COG, which I understand is one of the highest paying COGs, County of LA. I know I work for them. They have fairly high salaries for a government organization. Cities of LA, Rolling Hills Estates, and Torrance. So I don't know that that's representative or not, but again, this should be done as a whole.
I mean, point of order. So here's the thing. I don't think we're even talking about salaries at this point. All we're talking about are job descriptions, and the holistic view of salaries and budgets is down the road. I mean, we still have the independent contractor discussion that we still have been, and probably one of Bernadette's many questions involve that, but that is where we're going to be still talking about that. That discussion is not done tonight. It's only about creating job descriptions for the types of people that we need working for the organization, and there's no salaries attached to that tonight. That's a wholly different discussion.
But the salaries are attached from basically from the April thing, and then now today we've now identified what positions.
But if I can just say, the salaries are approved, the budget is the budget. We must live within the budget. We cannot hire anybody at a position higher than we can afford. We also, all of our employees are grant funded. If we lose a grant, we get rid of that employee. So there are a lot of constraints in the salary. Just because we have somebody that can get 99,000, well, that doesn't mean we're going to hire them in that particular place for that particular position. We have to live within our budget, which you all adopt. I don't know if in your own cities you go through every single job description, but that's what we're doing tonight. We're actually just doing the job descriptions that we can use to hire people.
And all I'm saying is that we need to know what the independent contractors are going to be making.
No, you don't know. You don't need to know that. What you need to know is what the job description is for the executive director and the deputy executive director, so that when you do have the conversation about the independent contractor, you have a job description of what you're going to actually ask them to do. And that's what's on the agenda tonight. When you decide that you want an executive director that's an employee, you currently have no job description for that position. So you have to have a job description so you know what you're hiring for.
Well, all of this should be done at one time, so we have all the information. And it's not fair to say that, oh, we're gonna do the independent contract and it's gonna cost the COG more money to convert.
And you, of course, feel that way. You can make a substitute motion and see if that gets a second. If you want to do that at this point, there is a motion on the floor. Did you want to make a substitute
Well, I
motion?
mean, to table it until we have an idea of what the positions are for the independent contractors and the salary ranges for them and.
Okay, so
so
there's
we
a
can-
substitute motion on the floor to table this to a future meeting. Is there a second?
I'll second it.
Okay, so it's been seconded. Discussion on the substitute. motion.
Just a point of clarification. So how does it happen that we have no job descriptions at the moment? We have all these staff people.
Because we have job descriptions. They're very, very old. We have no job description for executive director and deputy executive director because they're contractors right now. So we have an incomplete job description list. And what we need is to update and complete our job description list. That's all we're doing tonight.
Well, I mean, we certainly had a job description when we hired the
I
contract.
have a contract that has pages of tasks. That's not really like a job
So
description.
you're saying refining it and putting it on
Making
One
it
page
something that
description.
is a normal job description, not a contract. And that's what we're creating tonight.
Okay, any other further discussion on the substitute motion? David, help me out with the vote here. Should we go ahead and ask the people that are virtually to do a yes or no with their?
I'll do a roll call.
Okay, we're gonna do a roll call. So the substitute motion is to table this item to a future meeting.
I'm sorry, table it until when?
We don't know.
Well,
What is it all together? We have no date.
Discussion, and so we have everything all in front about all the information with the
Full
independent
picture.
contractors, with the employee, and what they would be designated as, what position and salary range. So we have a picture of all of that before we approve, because we're in essence approving the positions too for the current employees.
are you clear on that, Olivia? Okay, Aurelio.
I'm just gonna say that since this is my second meeting, I don't have the background, I'll respectfully abstain from this vote.
Okay, and you can abstain during the roll call vote as well.
Okay, so on the substitute motion to table until the whole picture is determined. Carson, Cedric,
You need to voice vote here, Cedric, if you're on the line.
I'll come back to
He's doing the
But you're
other.
muted potentially. Can we see the screen? So we can you do
you.
the
Oh,
He's on his other meeting.
do the
Cedric,
gallery so we can see everyone?
Oils. Tanaka,
Why don't you say the same?
uh,
What did you say? Okay, so one no.
Hawthorne,
No.
Hermosa Beach,
No.
Inglewood. Not here. Lawndale.
Yes.
what did she say?
Yes. Lamita.
No.
LA,
No.
Oh, sure. it's there.
Manhattan Beach,
No.
Palos Verdes Estates,
Abstain.
RPV,
Yes, I mean, no, sorry, no.
No.
Redondo Beach, Rolling Hills,
Yes,
Rolling Hills Estates.
No, I don't think you vote. Isn't Steve the vote, the delegates?
Yeah, it's Steve, you're the delegate. You can,
Carlson is back as yes.
You're asking for Rolling Hills Estates?
Yes.
yes.
Motion to table.
Yes.
LA, Torrance.
Abstain, please.
LA County District 2. No. LA County District 4.
No.
And then I'm gonna go back to Carson. The motion was to, substitute motion was to table.
Cedric? Cedric, are you back?
Can you hear me now?
Yes.
No.
Okay, so it's 10 votes.
Okay, and how many votes do we currently need now that?
I know a lot of people are
Councilmember
here.
Rosado joined?
And we also have Alfonso and we have
Let's make sure we know that number.
Lodi, Joe, Bernadette, Dee,
it doesn't matter. Because we have 18, then we need 10,
yeah.
and we have 10.
Okay, great. We
So
don't-
it doesn't matter how many we get.
LA votes. Oh, LA only has 2.
We have LA City
LA
gets 1 and LA County gets 2.
It's 2. We have 18 votes out of the total number of us.
All right.
So we need 10.
So B, I think the point was taken in regards to that
It's not-
holistic approach, and I'm sure staff will take it back with a
Sound good?
bunch of information. I'll make sure that it's accurate. So anyhow, so the substitute motion failed. So the original motion on the table is to go ahead and approve the positions and approve consent item C. I don't think we need to do.
It was B. It was B.
Yes.
We don't.
It was-
Let's do it.
Okay, so to approve consent calendar item B, any opposition?
Yes.
Yes, Londell.
Londale is a no. And Rosenthal is a no. Okay, abstentions.
Lawrence.
Any other abstentions?
I know, I need to.
All right, next item.
Mr. Chair, can I just say that if anyone has questions, like if Bernadette has questions, I would be more than happy. We talked to be offline. We'd be more than happy to talk to anyone offline, especially on a consent calendar item. So I make that offer.
Yeah, and I would also say, I mean, obviously, there's a lot of people on this call, so the more we can do pre-meeting to answer questions, so we don't do it during a board meeting, would be much appreciated by all.
I was on a call.
No, I'm not,
Just
I'm
saying.
not pointing out one
Okay.
person. I'm just saying if, I'm sure staff or our legal team would be available to talk to anyone before any of these meetings. Next item.
The next item is the Alcove Youth Center, a presentation by the Beach Cities Health District. Want to introduce our speaker?
Yes. Yeah, thank you, Jackie. So tonight we're honored to have Ollie Stewart, who is the Chief Partnership Development Officer at Beach Cities Health District. She works to measurably improve the health and well-being of Beach Cities residents by identifying, incubating, and implementing opportunities for innovation across the lifespan, including funding models, healthcare system integration, public policy, and technology and data applications through a public health framework. She also oversees partnerships and development for BCHD and is leading the team to open Alcove, is it Alcove?
Yeah.
Alcove Beach Cities in the fall of 2022. Ollie?
Thank you. Thank you so much. And it's an honor to be here tonight with all of you. On behalf of Beach Cities Health District, Tom Beckley, our CEO, wasn't able to join us tonight, but he gives his regards. I also have here with me this evening, Jacqueline Sun, who is our Director of Wellbeing Services at Beach Cities Health District. And so tonight we just wanted to give a brief update on something new coming to the South Bay. Actually, we had the support of the COG early on when we were applying for this state funding opportunity. We also had the support of several of our cities. So we want to thank Council Members Stern and Armato from Hermosa and Manhattan for serving on our steering committee and guiding us through this process. Also want to thank our Supervisor Han's office. They were instrumental early on and helping gaining the support of the supervisor and the County Department of Mental Health. And so this really has been a collaborative effort for the past really 4 to 5 years to bring this dedicated youth wellness center space to the South Bay. So I'm going to go ahead and share my screen. I have some slides attached here. Right here. If I get maybe a thumbs up from anybody in there that you can see the slides here on the screen. Okay, thank you so much. All right, so from Beach Cities Health District, I'm going to talk primarily about our youth programs, but we do go through a 3-year strategic planning process to establish our health priorities. I know these are health priorities that we share regionally, but specifically tonight, I'm going to talk about mental health as well as substance use prevention as it relates to Alcove. As an agency, we work closely with our Beach City school district. So this is just a sampling of some of the programs and services that we offer. But through COVID, we had the opportunity to work more regionally. And this opportunity was largely through our South Bay Consortium for School Vaccines, where we partnered with the Department of Public Health, as well as with our 11 South Bay school districts that were not LAUSD affiliated, to offer COVID vaccines for at first teachers and school employees, and then later for students. So really through this collaboration with our school district partners and learning more about what their health needs are, we hope to bring AllCove to this wider region of the South Bay. So I had mentioned some of our COVID efforts. Other opportunities that we partnered more regionally were around an early symptom assessment tool. We worked with our South Bay school districts as students were returning to campus after they had been out, to safely screen their students for COVID. And we continue to work closely with school district partners to figure out more ways that we can collaborate and be more effective with our resources, with funding, and bringing more of those resources to the South Bay. So AllCove is based on an international model of how do you transform the system of mental health for young people. I'll share some data this evening, and many of you may be aware through your work in the community and your school partners that we're experiencing a mental health crisis, and especially for young people that was not helped by COVID. The Surgeon General recently released a report just about the great mental health need that we're seeing across the entire lifespan, but especially in our young people. So AllCove is really intended to be an early intervention, a prevention space, so we can prevent the long-term implications for untreated mental health concerns. So while this opportunity and while this facility will be located on our campus in Redondo Beach, it is open to any young person in the South Bay. So this funding is coming from the state's Mental Health Services Oversight and Accountability Commission. And so through this opportunity, the COG was able to support this effort, as well as some of our other local city partners, to make sure that regionally, any young person, regardless of their ability to pay, could walk in the door to AllCove and get these mental health services. So I mentioned some of the data. These are, you know, some of the highlights or potentially lowlights, depending on how you're looking at this, of really seeing that mental illness is peaking in adolescence and into young adulthood. So the more that we can do to address these concerns early on and get that early access to care, the better long-term outcomes we're going to have for the young person, and also on the system and the long-term burdens on the healthcare system. So as we look at the continuum of mental health care for young people, we know a lot of our school districts throughout the South Bay are doing really good work. They're already bringing in community partners, clinical agencies to offer more mental health support in the school setting. And then we know on the other end of the spectrum is really the need for more intensive psychosis programs, as well as some of the more intensive work that the Department of Mental Health is doing with their law enforcement teams and their pet team as well. And so AllCove really sits in the middle of that. It's intended to complement the work happening in the community and in the school setting, while also providing a really youth-friendly space that they can come in and access these programs and services. So intended to supplement, not supplant, what's happening in the greater community. So as we look at what AllCove is and what AllCove is not, it really, as I said, is intended to be prevention, early intervention, lots of community outreach, engagement, getting the word out that these services are available, with a lot of linkages to the other resources in the greater South Bay. So if a service can't be provided for a young person within AllCove, there will be a strong referral network that will be provided so they can get that care that they need, whether it's intensive outpatient or hospitalization or psychiatric needs. So I think these are some bigger issues to talk about more regionally, because we know those resources are limited, as well as we talk about adolescent psychiatric beds and other things that we really look at more intensive needs as we're stabilizing a young person who might be in crisis. So here are some of our youth advisors. We have youth representatives from the South Bay that are guiding us in this decision making as we open this space. It really is youth driven, so they get to be involved in all of the decision making as we open the doors to AllCove Beach Cities. They've been able to meet with some of our elected officials, some of you even, to have the opportunity to share what they see are the greatest needs of their peers, really focusing on this prevention, screening, early intervention, connecting connection to treatment, and also decreasing some of the stigma that we know is prevalent in mental health. I think young people are more willing to have these candid conversations, and I think even the design of the space is intended to reduce stigma. If a young person is coming in and meeting with a psychologist or a college counselor, they're always doing it in a way that's intended to decrease stigma and create anonymous access to the services. So even within the chat rooms, which are the meeting rooms or clinical spaces, they're constantly rotating. So a young person doesn't have the stigma associated of always going into a certain room to see a psychologist or a mental health professional. So I think another key component of Alcove is really this rapid, easy, and affordable access to care. We hear frequently from families and from young people that if they're willing to pay pretty significantly out of pocket, it's maybe a little bit easier to access care. But even for youth psychiatry, months can go by before you can get in to see an appointment, and we don't want that to be a barrier. So really making sure on their very first visit, if they're not able to see a clinician at that time, that they would be able to schedule an appointment in the near term so they can be seen right away. And then the integration, so not only co-located of the services that are offered in the space, but really working across the disciplines and the core service streams that I'll share to make sure that the young person and the outcomes intended for them are really coordinated across all of these service areas. So when we look at bundling this all under one roof, I've talked a lot about the mental health services. There will also be physical health services provided by a physician and a nurse on site, substance use prevention, again, in this prevention early intervention training. I know we've talked a bit about the need for more community awareness about life-saving treatment around opioid use, since that's an issue here locally as well as across the country. So what are some of the things that we can do to build community resilience in young people, not only if they're accessing these services, but also to provide more support, peer-to-peer support for their friends. Peers are a really important component of this. When a young person walks in the door, they're not going to be greeted by an adult clinician. They'll be greeted by a peer who can walk them through the facility, tour, talk about the programs and services, and make sure they're connected to what they need. Also available, supported education and employment. We know that for young people, as they launch from high school into whatever is next for them, that can be a real stressful point in their life, whether they're pursuing college, career, other workforce development. So helping navigate a young person through that launch period, and then into their young adulthood. As we know, once they're transitioning out of the home environment and all the challenges that can come with establishing those new life skills and incorporating some healthy coping mechanisms and building resilience across some wellness service program offerings within the space. So these slides will be shared and also available on the website. So I'm not going to go through them all individually, but I'm just going to quickly page through these so you can see some of the types of services that will be offered for mental health with clinicians on site, some of the physical health services that will be offered through the physician and the nurse, and I'll share the partners that we're bringing on board in a few slides as well, looking at some of the substance use prevention referral opportunities within Alcove, peer support that I had mentioned, that it really is youth-led, and they will play a huge role within the space, and then doing a lot of outreach into the community at community events. Family support. We know sometimes the family environment can be another cause of stress for a young person. And so as we have the opportunity to work with the entire family unit, whether it's around counseling or therapy or development, that we would invite the parent, if that would be helpful, the caregiver, to be part of that conversation as well. Supported education and employment. And I think this is really where our regional partners will come in with our adult school, with El Camino, with others, to really make sure we're addressing not only the health needs, but also the development that a young person might need to successfully launch after high school. So these are some of the types of life skills and wellness services, and we're really relying on a network of a lot of partners within the community to be able to come into the space, offer these services, and if we're not offering them on site, connecting them to the resources that might be available elsewhere. So we went through a competitive request for qualifications process in the community, and this was an opportunity for the partners that many of our schools or community organizations have been working with for a long time. So these are the service providers that will be under contract with Beach Cities Health District to provide these services. So UCLA Health and Venice Family Clinic, our FQHC, which was formerly the South Bay Family Healthcare Clinic on Artesia and Redondo Beach. They'll be primarily serving the physical health components as well as some of the other mental health components. South Bay Families Connected, which has been a longtime partner of ours to do parent education and engagement. Some of the non-traditional partners that you would see in a mental health space include Indivisible Arts, which is based out of Hermosa Beach, the Volunteer Center out of Torrance. So bringing together all these partners to provide the whole host of core service streams within all Cove Beach cities. In addition to this list, we have quite a few in-kind partners that will be offering support in the space, including NAMI, South Bay. They do a lot of really great education and peer and family support programs, as well as others in the community. So we'll be rolling out that list in the coming weeks as we get ready to open up. These are our youth advisors. Again, they're from the greater South Bay. They are technical assistance providers to us as we make decisions about the space. They've been able to be involved in everything from facility design, furniture selection, making decisions about which providers we're going to be in the space. They'll be interviewing candidates for our clinical manager job that is currently posted right now. Advocacy is another area that they've had the opportunity to interact with stakeholders, local elected officials, federal elected officials to talk about the health need of their peers. And again, I had mentioned they'll also be involved in kind of the outreach opportunities. If we're going to a business or a health fair or a school setting, they'll be able to talk to their peers about what All Cove is and how it might be able to help young people in their community. So this is a sneak preview of what the space will look like. It is on the 4th floor of our Beach Cities Health District building on Prospect Avenue in Redondo Beach. So it looks a little different than a typical clinical setting, and that is by design. That it wants to, in designing the space, and this was with youth advisors as well, it was really intended to not feel like school and not feel like a doctor's office. And so creating lots of coves and meeting spaces where a young person could come in the door and maybe be on their own, but not be alone. And so even the name and the funny spelling of All Cove, it's intended to be inclusive, that all are welcome, that it's a safe space, a safe cove for them to be able to come into. And maybe they're just first couple of visits, they're just doing their homework or participating in a wellness activity. And then maybe later down the line, they decide they'd like to access more of the clinical services, and that would be available to them as well. So this is the cove. This is essentially the living room area of the space where they can come interact with one another, but also have private seating areas, small group meetings. When we do convene our larger youth advisory council, we have about 60 young people from the South Bay that serve on Beach Cities Health District's Youth Advisory Council. They'll be able to meet in this space. So we hope for this to be a gathering place in addition to a place where young people can access these clinical services. So as we look at financial sustainability, that's a big piece of this pilot. I mentioned the initial funding from the Mental Health Services Act for the 4-year grant term. So we're about 10 months into that grant term. We also had the opportunity to work with our Congress member, Ted Lieu's office, to receive $1 million of federal community project funding for some of the infrastructure related to the space. And then we're really going to be working with our system partners to develop some of these long-term reimbursement strategies, whether it's through the Medi-Cal population, private insurance, other fundraising opportunities to make this sustainable. So I didn't mention this earlier, but we are going to be the second location open in the state of California. So Palo Alto was the first location to open open. Stanford is the technical assistance provider who is working with grantees, including Beach Cities Health District across the state. So we're one of 5 new grantees that will be opening these centers, and they're really intended to be recognizable. So if a young person grows up in Torrance, moves away to go to school or get a job somewhere in Northern California, that they would recognize Alcove as a place that they could access these services. And so really working collaboratively across the state to figure out how we can make these Alcove centers sustainable and scalable at the same time. So we're excited that right here in the South Bay, we'll have the next location of Alcove open, and looking forward to doing that next month. So October 2022, right around the corner, we'll be doing a ribbon cutting and a sneak peek of the space on October 18th. And I can share that with this group. We'll be planning to do a larger community-wide celebration that will do a lot more outreach to young people within the community in January after we have a few months of operation. So we'll be doing a lot of community events and outreach. So if there are opportunities for us to come to events that your cities might be having, we'd be happy to do that and get the word out about Alcove and what's available. So wanted to touch just briefly before I can open it to questions. So Alcove is going to be opening in a temporary location, as I had mentioned, on the 4th floor of our existing Beach Cities Health District building, with the eventual plan that it would be kind of a key component of our future healthy living campus. So I'm not going to spend too much time talking about that, but this would be an opportunity in addition to about 2 acres of open space, a PACE program, which is very similar to Alcove, but for older adults in the community, for them to come and access drop-in services during the day, as well as residential care for the elderly. So we've gone through an iterative process of refining the plan based on some feedback that we've heard from the community, and that continues. And so I just wanted to bring to this group that we are continuing those conversations, engaging with stakeholders. We want to hear from the community, and you can see kind of the phases of the plan and some of the changes that we've made over the past 5-year planning process to get to where we are today. So I had mentioned the open space, Alcove, a key component of this, and this is now our campus master plan for that land right there on Prospect and Redondo Beach. So last thing before I open it up to questions, and I have Jacqueline here, as I had mentioned. I know I focus specifically on young people 12 to 25 that can come into Alcove and access these services, but we do offer many free programs to the community in the greater South Bay around mental health for all ages. And so here are some of the things that are upcoming, working closely with county agencies, including the County Department of Mental Health, to do more skill building and training. I know we're talking with local law enforcement about building more capacity through a critical incident response team. So these are just some of the ways that we're working to build more awareness and a more ability for people to access whatever care they might need, mental health or otherwise. So I will stop sharing there and turn it back over to Jackie. And if there are any questions, I'd be happy to answer them.
Any questions for Ally?
We've got Olivia.
Yes, Olivia.
Thank you. Thank you for that report. I enjoyed hearing your outreach effort, and wish you luck. I'm curious, I have several questions, but I think I'll try to limit it to 1 or 2.
Okay.
How do you identify those in need of the service? That's my first question.
How do I identify those in need? Yeah, I'm sorry.
Yes.
You just repeat that question.
Can you say the question?
Yeah, how do you identify those in need?
How do you identify those in need of the service?
Yeah, I think that anybody can drop in. So I think that that's what's unique about Alcove. Some young people might come in with an already identified need. Others might come in because they heard one of their friends talk about it and they can go do a free class on something that they're interested in. And so I think that that's a little open-ended in that it is a space for everyone, and maybe some are accessing mental health services and others are not. And I think that's through kind of this peer outreach opportunity that they present. Here's what we do here at the space, and it's for the young person to decide and choose their own path of the services that they'd like to offer. I think the other opportunity is really through referrals. We'll be working closely with the school districts. So we know there's some capacity on school campuses to address mental health needs, but we also know there are summer breaks and holiday breaks and other times where they might not be able to continue accessing those services. So we'll also be working closely with school counselors and other school leaders. We had the opportunity to brief superintendents about a month ago about ALCOVE. And so I think lots of outreach to those, what I would say are our traditional partners, schools, cities, but also the business community as well. So they're aware of what's available at ALCOVE.
You said that the young people are in a mental health crisis. That young people are facing a mental health crisis. So how will you measure success in your program when you're reaching out to young people who are facing this crisis?
Yeah, and I can speak to some of the data that we have. So some of the data that I shared was national data, and there's been a big report done recently of the state of mental health of young people across the nation. I think locally, at least for the school-aged audience, we rely on California Healthy Kids Survey data. That's a survey that most school districts in California complete. And so some of those key indicators that we've been measuring over time include suicidal ideation, missing school due to sadness, loneliness. I think looking at some of the anxiety and depression indicators as well. So we'll be looking to move the needle on all of those key indicators. I think for the young adult population, working closely with the Department of Public Health as they do needs assessments and look at data related to those key indicators. Substance use, we know that the concern of opioid use and fentanyl is a top priority for us as an agency as well. And so I think we'll be looking at a combination of data points to measure success. And then also in the process metrics that service utilization, I think we'll know, 6 months into operating what we're seeing. I think out of Palo Alto, they were surprised that there was more severe need that was coming in the door, and they were needing to do a lot more referrals out to more intensive support and treatment. And so I think we'll be tracking all of that through a shared data set with Stanford. They've created a tool called the Data Cove that will be managing all the intake. So then we'll be able to see not only some of the trend indicators over time within the South Bay, but how we're doing compared to the rest of the state and the ALCOVE centers in the rest of the state. And so that's where I think we'll look to our learning community of other ALCOVE centers, as well as the support of Stanford as we're implementing throughout.
Thank you.
All right. Any more questions? Holly, thank you so much for taking the time tonight and sharing all that with the group. We really appreciate it. I also want to say to both Stacy and Hildy for taking all the time and meeting with her and the team and all the great work. So thank you so much.
Thank you. Thanks for that.
We mentioned the survey since we're on this.
I was going to mention it later, but now's the perfect time to do it.
Yeah, so while we had the Beach Cities Health District, we work with them of the SPA 8 Health Working Group. And one of the projects we're working on is a survey for our city administrators and council members to kind of identify some of the gaps that we may have in mental health care. And so I'm kind of just sharing what we have so far. So be on the lookout for the survey. Again, it's just to kind of assess what we perceive our needs may be so that we can better direct our mission at the health working group meetings. So just wanted to make that announcement.
It's a survey specifically on mental health. And what we're really asking, we want to send it to you and to your city manager. And I thought maybe your park and recreation director, because they interface with people. And so we want to ask you what you're seeing as mental health issues, or do you have, does your city have anything that they'd like to bring to our awareness so that we can address it at the working group and they can address it at ALCOVE or the other facilities that they have. It's going out either tomorrow or at the beginning of the week. I mean, it's ready and we're just got to get it. I have to get an email together.
Okay, got it. All right.
Yeah.
Thank you, Ronson, for mentioning that. Appreciate that. Thanks again, Ollie. Appreciate that. All right, next presentation.
Our next presentation is Lindsay Lobster from the Department of Public Health. And Lindsay, was coming every month. And we decided that she's going to be coming quarterly. This is the quarterly visit. In the off months, she'll be sending us information for the packet. But so the next time we're going to see her is January, actually. but this is Lindsay is going to give her report on updates on the Department of Public Health.
Lindsay?
Hi, good evening, everybody. Nice to see you all. Can you hear me okay?
Yes.
Great. Okay. I will share my slides and try to get through these quick just because I do know we're a little behind. All right. And let's see if that happens. Okay. Can you see this okay?
Yes.
Wonderful. Okay. So again, my name is Lindsay Lastra. I'm from the Department of Public Health, and I do present here. I will present this presentations or updates quarterly, and this is my last one for the year, as Jackie just mentioned. So I'll be doing just some quick updates about COVID, monkeypox, and then just updates on our projects, as well as our Center for Community Wellness and just some resources. So again, well, you guys have all probably been seeing data, discussions around the new indoor masking requirement that actually changes that are happening that came out today from Dr. Ferrer. But our biggest thing is that our numbers are basically steadying and still going down and becoming a little more steady. And so we are currently still at a low, or we are now at a low community spread. And so, which is why we've been able to do this new change to our indoor masking requirements. And what you'll see here, and you'll have all these slides, so you can review these later. There are certain areas where there will be no change, and then there's areas where there will be changes. So where there are no changes are more higher risk areas, such as healthcare settings, long-term care settings, as well as the adult and senior care facilities. And then obviously, if any location has a policy or for business or venue has a policy around masking. Also, we will still require masking for anyone who have symptoms after 10 days. For 10 days after started symptoms from COVID or positive tests when eligible to end isolation and are returning to work or school. So basically, if somebody's been exposed or it was positive and they need to wear a mask for those 10 days after, or 10 days after exposure to someone when they were with COVID, who was COVID positive. Where it has changed, let me go back. Where it has changed is the correctional facilities and shelters no longer will be required, but strongly recommended. Also, the public transit and inside the transit hubs is strongly recommended. And again, there might be some businesses that do require the masking, but that will be up to that business at that point. Where we have potentially another strongly recommended area is where individuals with a higher risk. So that really means kind of like we have these strong recommendations for areas that are closed spaces and have poor airflow. We would recommend masking. Crowded places, as well as those close contact settings, especially where people are talking really close together. That's where we would recommend them. Otherwise, all other indoor public settings, businesses and government offices, it's really an individual preference. As a person comes in, they will decide. It's up to each person if they want to wear a mask. This is just a really friendly reminder. And for those of you who aren't aware, there is a new COVID booster. It's basically have the ability to have various variants in the vaccine now. So we really are promoting this new booster. As you see here, 12 and up, you can get the Pfizer only, or 12 to 17. 18 and over, you can get either the Pfizer or Moderna boosters. But basically, I'll have this slide for you all as well if you're just trying to figure out who should get which dose and if the booster is accessible for kids, right? 6 to 11, still no, only 12 to 17 as far as the kids. Flu season is around the corner. We're really expected to see a pretty big flu jump this year in comparison to the others because we were all kind of in that lockdown, more, staying home. So we are recommending the flu vaccine. Those should be sought out by the community as well before the holidays start. And then monkeypox, just as a reminder, there is specific areas of specific populations that should really be looking to the monkeypox vaccine. I'll talk about that in a moment, but just kind of one of those where, as we're looking at the fall, thinking about some of these boosters or some of these vaccines as an opportunity to get protected. My data here is from last week. I didn't get this week's data just yet, so I just want to share basically the numbers are steadily kind of they're staying steady. They're still inching up, but we're not seeing the dramatic increases that we were seeing some time ago. So we're hopeful that as we see the data, we're actually seeing a little bit of a decline. And so we're in that phase of hoping that this is kind of like the new trend where we can actually see numbers going down as things are getting more under control. We do hope that people who want to get the vaccine, who have not, who are at high risk, and people who are at high risk would be those who are essentially in close proximity with people who have monkeypox diagnosed. So it's really one of those like people who know that they were exposed would know and would want to go seek out that treatment. And so we have here information on where to get the vaccine. You can go to our myturn.ca.gov to get an appointment, and then also to look up the eligibility on who should be getting the vaccine. Oh, and I didn't cover, and then there is a new minor consent policy that minors who are 12 through 17, because we are actually seeing numbers go up slightly on our youth group, especially the 12 to 17 LGBTQ population. We want to make sure that they are aware and can receive the monkeypox vaccine without parental consent. And so we're really trying to make sure just that the information is available for all to know. Any minors who are 6 months to 12 years will continue to need a parental consent and be accompanied by the parent. Okay, I did want to share some program updates as far as our Spot 8 stuff. We have new staff under our education sector. So as you all saw, we had a lot of different opportunities to really engage with our partners, such as yourselves, during the pandemic. And one of those was the education sector. We had always been somewhat related, like we worked a little bit here and there, but through the pandemic, we built some really good we established some really good relationships. And so we really want to keep those going. And so we now have education sector liaisons who will be working closely with our partners in the education field. These folks basically will be connecting with the school districts, the early childhood education centers, and institutes of higher learning. The education liaisons are supporting larger public health initiatives around oral health and water fluoridation, as well as school safety. And these education liaisons will serve as the point of contact between public health and the education sector with the goal of furthering our DPH initiatives. I wanted to put the names here of our two employees. We have Berna Leonilo, she is our public health nurse, and Linda Kalasapa, she is one of our program analysts. Actually, she's dedicated to this. I want to share those names because you might see them come through in different opportunities. As you all know, public health is a really big group. Everyone connects with different people from public health, so it might be just helpful to see the names of our folks. And I can have them join a meeting in the future at some point, maybe to share an update on what's going on with that if you are all interested. The next thing I wanted to share as an opportunity is around employment. So we have partnered with AmeriCorps, and we will be hiring AmeriCorps members to be staffed on our public health teams. And actually they will be in part of my team in Spot 8 and also in my other area in Spot 7, which is the eastern part of LA County. We will be hiring 10 AmeriCorps members per each SPA, and they will be doing out community work around public health initiatives for each of the SPAs. We are welcoming for you all to share these opportunities with your constituents. We welcome, basically, we really want to promote this. We want the community to come out and apply for jobs who want to get experience in public health. They get a stipend, they work for a part-time with public health, and essentially get a great opportunity in a very kind of more of a professional way, but still being able to be a part-time job. So this next slide shares the flyer, and you will have that copy so that you can share that with also your constituents through your city websites, as well as any partners in organizations. An opportunity for you all also to share, and we do host this new U Resource Fair every month, fourth Thursday of the month. People can come in and get different services. This is led by ADAP, the Asian American Drug Abuse Health Intervention Program. They basically provide an array of services, and really we want to promote this. This is being done in Inglewood at the Curtis Tucker Health Center. So please, you will have this flyer, please promote that event, or yeah, that monthly event. And we have our new food distribution event also happening at Curtis Tucker. It started in August, and we've actually seen a big turnout. It's been very successful. The need is really big, especially because in the Inglewood area, we don't have many food distribution events. So this has been very well received by the community. So I will share this flyer as well, and please ask that you all share it with your constituents. And finally, I want to share one of our initiatives from the department, the African American Maternal and Mortality Initiative. They lead different groups around Black women, Black and African American mothers, breastfeeding, and family support. One of the groups is this Expecting Fathers group. They provide, they're actually providing a virtual workshop for Black fathers who are expecting, and we'll get basically different types of lessons. And it's really more of being how to learn to be integrated with the whole process of having a new baby, and also learning how to support your partner as well as becoming a father. So it's a great opportunity. So I ask you all again to share with your constituents. And finally, AIM also, and AIM, African American Infant Mortality Group, is AIM for short, has this new campaign around having decals and table tents promoted at different businesses who are willing to share this and become a safe space for breastfeeding mothers. And so if any of you would like to share this with the Chamber of Commerce, the contact down there is Ashley. She will be more than happy to share how to get this, how to get a decal, and what it is that this requires. It really actually doesn't require anything of the business. It's just to say, put this up in the business window and say, we welcome and support breastfeeding. And that is it. Any questions?
Any questions for Lindsay? It doesn't, I can't see. Would we be able to see the hands?
Lindsay, do you mind ending your screen share?
Not at all.
Thank you.
Trying to, there we go, stop share. Thank you.
Doesn't look like we have any questions. You were very complete in your presentation. Thank you so much.
So welcome. Nice to see you all.
All right, great to see you. Thank you. Next item.
Next item is the transportation report, and I'm going to call on Steve Lance to do that. Steve?
Hey, Steve.
Hi there, guys. The Transportation Committee met a couple of weeks ago, and the principal topics at that committee was an update on Metro's I-110 Express Lane revenues. We've been concerned that they are not dedicating those revenues to the South Bay or the corridor adjacent to where the revenue is being generated. So we had a discussion about that. We also kicked off the annual Measure R&M Metro budget request process, which I could talk about later in another slide, and the normal updates. So it was a fairly straightforward meeting. Oh, and also the Metro 22-23 budget. There was a presentation on that.
And then your Metro board updates.
Steve, we have your Metro board updates on the,
Oh, okay. Well, let me go into that then. David, you want to pull it up? Oh, it's up.
it's up.
Okay, first of all, an announcement. Da, da, da. The Crenshaw LAX line is opening October 7th. There's going to be on Friday, October 7th at noon, there's going to be a ribbon cutting ceremony. After that, it'll be open for free rides that weekend through Sunday. The line will open up between Expo and the Westchester station, which is just north of the LAX connector station. The LAX connector station and the final connection to the C line will open up either in late 2023 or 2024. So that's that slide. You want to go to the next slide, please? At the meeting today, at the Metro Board meeting, they discussed a new program that they're developing in the context of the upcoming 2028 Olympics. You may remember in 1984 Olympics, they had a mural program that was very successful, and many of those murals are still being refreshed and are up around the city. They want to expand it, include more murals, and they also want to create temporary centers of art, culture, and recreation during the Olympics. So if your city has an Olympic site or you want to be a part of that, you can contact Metro and they'll plug you into that ancillary program that's going to go on during the Olympic and Paralympic Games. Next slide. The I-710 South Corridor Task Force. This program has been going on for several years now, but they've finally come to the point where they've selected 4 projects for grant applications to the state for funding. I think they have a list of 20 or 30 projects, but they've pulled 4 that meet their goals. And they approved today a vision statement and guiding principles and those goals. They also renamed the project. Rather than being called the I-710 Corridor Project, it's now known as the Long Beach to East LA Corridor Mobility Investment Plan. Reason is that they're more interested in the impacts of the corridor and of mitigating those impacts in the surrounding neighborhoods than in expanding the capacity on the corridor itself. One little side note is, although the Port of Long Beach is involved in the Gateway COGS program, the Port of LA is not included in the new program. So we'll have to talk to them about their interest perhaps in doing similar programs in the South Bay when we get our I-110 program going. Next slide. Another long discussion at Metro today was regarding fare capping. What they're doing is restructuring and simplifying their entire fare structure. Now they have a very complex set of fares for seniors and disabled and low income and students, and they have a day pass and a monthly pass and a weekly pass. So what they're going to do is jettison that old program and create a new base fare of $1.75, which is what it is today. And they're going to cap the rider's daily fare at 3 times that $1.75 figure. There will be similar weekly and monthly caps. So if you're taking 3 trips, you'll have paid all you'll need to pay that day, and the rest of the trips that day will be free. You'll still tap using your tap card, and the tap card will be a way to get away from Metro handling cash, and it'll all be moving over to the tap card environment. In order to do that, they need to have a fare policy change, and they have to update the tap system. So they're looking to report back in December with a request to adopt the new fare policy, and then to do the changes in the tap equipment and software after that policy gets approved. They also want to talk to the other operators in the county to see if they're interested in joining this simplified fare structure. One of the concerns that was raised today was what happens to transfers, because today if you board, you can get a transfer for like a quarter to go in the same direction of travel for 2 hours. And so that was to be determined and needed to be integrated into the tap machine as well. So I think that's it for the fare capping update. Next. Our multi-year sub-regional program, both the Measure M and the R Transit Investment Program were approved today. That's the program that we approved last March or April, where we submitted our list of projects for Metro to approve, and they got approved today. So the project lead agencies can now begin working with Metro to execute the funding agreements for projects with funding programmed beginning in 22, 23, 23, 24. In addition to that, we're going to be holding one-on-one meetings with city staff in the coming weeks to review their existing projects and new project requests. So we're not sure yet how much money we're going to have in Measure M. We know we don't have any money for new projects in Measure R, but we want to have the initial discussions, the initial one-on-one discussions with your public works staff or your traffic engineering staff or your transit staff on what's the status of the current projects, what are your cash flow needs going to be, and whether or not you want to propose new projects. The updates of the current projects, the information is due to us by December 1st, and the new project applications are due to us by, I think, mid-January, I think we've decided. And that's it.
Well, Steve, I was going to mention that one of the things we're going to be doing at those one-on-one meetings is asking cities to think about whether they have anything, especially the first quarter cities, on the local travel network to put in projects at that point for any work on the local travel network. But also, we did a really wonderful thing years ago We fought with Metro to get Measure M money used for broadband. And of course, you remember how, for those of you that were here, remember how incredible, what a incredible fight that was. Well, now other subregions are walking in and getting Measure M money. Metro's just giving it to them, anybody that asks for broadband. So we're asking our cities, we thought we wouldn't be able to go back because of the struggles we had. But we're asking cities, if you have other Measure M, if you have other sites that you want the fiber to go to, this might be a time to ask for a Measure M application, and then we can ask for more money for that if we have the money. So for example, I don't know if Linda or Linda makes sense at this point, but if you have a site that you want, please put it in these one-on-one meetings so that we can start figuring out if we need to ask for more money for the fiber network.
And we're also going to be embarking on a second program, which I call phase 2, which takes a look at the transportation applications that could be funded that would use the fiber network. So we'll be talking about the cities about that aspect as well.
Right. Okay.
Can I ask you a question about fiber networks since you brought it up? So thank you. Or either anyone that wants to answer it. So we had someone at our council meeting, they were concerned about the health risk with 5G antennas. And they said that they would like to look into their neighborhoods getting fiber optic or fiber network in, because you can apparently use the fiber network to bring 5G if you, is that true?
Yeah, I thought 5G is, you need very frequent towers for 5G, and the fiber helps help.
I think you need the fiber to support.
Right, you need the fiber.
Both then, it's not.
Right, right.
I think that the antennas are typically fairly short, or I mean, fairly close together in 5G.
Yeah, they are. They're closer together in 5G.
And the backhaul that we need to put in, meaning getting the data through the fiber, is the way to handle some of that distance, covering that distance to other locations like regional centers or other users.
You would need the fiber optic to actually have 5G network in your neighborhood.
Yeah.
I believe so.
That's what we understand.
Well, we built the middle mile. And the question is, how much further are we going to go? What other centers are we going to connect to other than the government centers that we're serving so far? So.
I mean, I guess, and it ties into the transportation, because if we are all going to 5G phones, right? And we want 5G service, then you've got to have the fiber network. So then you look at all the transportation corridors where most of us are driving,
right?
And where we need 5G when we're on the road.
Mm-hmm.
So I would imagine someone's looking at that, or could be looking at that.
Right, right.
We could be looking at that.
Yes, yeah.
All right. Thank you, Steve, for the report. Very good.
Sure.
Oh, we have a question for you.
Oh.
Yeah, Steve, given that they're doing this fare capping, the last I checked, Metro is letting anybody just come on the trains without a fare.
That's not true anymore.
Not true anymore. So do they
They have a program called the LIFE program, which is called Low Income Fares for All, which is if you qualify for it, you don't have to pay a fare. But they did reinstitute fare collection a couple of months ago.
Well, but I mean, they were charging fares, but they weren't anybody checking for fares except the sheriffs. And now they're talking about getting rid of the sheriffs.
But they've hired a whole new group of people called ambassadors that are going to start being on the train to provide customer service and such. I don't know whether the sheriffs or the ambassadors are going to check fare payment. It's always nobody wants to do it, but somebody has to.
I know. So where's this money going to come from? They're capping fares for people who actually pay the fares, and then they're letting everybody on the train that doesn't pay fares until they're caught, and then they're just bumped off the train.
They're getting hardly anything in fare box anyway.
Yeah, I think they're last I looked, they were getting about 12% of their operating costs out of the fare box. And they're looking for much more aggressive state and federal subsidies so that they could even reduce that further.
So they're still not going to put in machines like they have in Washington, D.C., where people just can't even get to a train unless they've actually paid a fare and put in a machine.
On the rail line, they have fare gates, but not on the bus system.
Yeah, they have the fare gates on the rail line.
They didn't have it before. They said Washington was saying it was too much money.
Right, right. They didn't
No,
have.
but they've done it now. They've instituted fare gates on the rail system.
Okay.
All right, very good. Next item.
Okay, the next item has to do with, we do this every September that there's an election. We looked at the ballot propositions, and David is going to go through briefly the ballot propositions, and we don't have a large recommendation this time. I actually don't have my agenda up, so I don't know what page this is on.
61.
Thank you so much. You'll be my page turner. So David is going to do this now. David?
Sure. So the first one, Proposition 1, that's the right to reproductive freedom amendment. We are just recommending a neutral position on that. It's not really a city issue. Prop 26 is one of the sports betting propositions. We had previously taken a opposed position to this one because it affects cities that have card clubs, so Gardena in our area. And we're recommending that you reaffirm your opposition to that.
We've actually opposed both of them.
You Guardians opposed both?
The both.
And if you notice, Rodney's sitting right near David.
26. 27 is to legalize sports betting online, this and mobile sports betting. So it doesn't have to be at a Indian casino or racetrack. We recommended a neutral position on this one. It does state there's funding for homeless services and gambling addiction programs, but how much of that money will ultimately make its way down to our programs isn't necessarily
The
clear.
amount they've already spent on advertising is more than they said they were going to provide for homeless
I
services.
actually heard this morning they've stopped the ads because they're losing and they don't want to spend any money. I don't know if that's true, but I heard this morning.
They were over the 400 million mark.
Right.
It's crazy. And the polling on both measures is really poor.
Yeah, and that's why I heard they stopped the ads. By the way, before David continues, this is just, we took a fast cut. We don't think these have direct impact to cities, but if you want to take a position, I mean, that's fine. So we're just telling you what we can.
The Proposition 28 would provide dedicated funding for art and music education in K through 12. We're not recommend, it's not a direct impact to cities again, so we're just recommending a neutral position. Prop 29 is the one that never seems to go away, the dialysis clinic issue. It's failed in all of the recent elections. And again, not really an issue for our local cities. Prop 30 is an interesting one. It would impose a tax on income above 2 million to fund zero emission vehicles and wildfire prevention. It sounds like something that we would support in concept, but there's a lot of concern that this is essentially a tax giveaway to Lyft and Uber type of companies because they want to use the funding to subsidize essentially their mandate to convert their drivers to electric vehicles. So you'll see that Governor Newsom actually came out and is opposing this one. And we're recommending a neutral position. And then the last one is Prop 31, which is a referendum on the legislature's flavored tobacco product ban. This one could get confusing where a yes vote means you want to uphold the ban. And staff is just recommending a neutral position on this one. And you'll see the note in there that we did bring this to the legislative committee, but there was no quorum on there at that meeting. So these are staff recommendations, not legislative committee recommendations.
All right.
Yes, I would like to recommend that we recommend a yes vote on Prop 31 because I think that it does have an effect on cities in that the purpose of tobacco products, flavored tobacco products, is obviously to inveigle children into using these products. And I think to the extent that our children would be involved and would be lured into using these products, I think it does have an effect on our cities. So I would recommend that we take a yes vote on that.
Second.
Yeah, and just to add on to what she's saying is ADAP, GDAP, which promote the non-use of flavored stuff because the school students are using it. It's enticing because it tastes good, it smells good. We support them in their efforts to not allow that to result.
So we're carving out that. Why don't we go ahead and vote on that particular one then? It's been moved and seconded. Any other discussion? Yes, Hildy. Are you going to talk about Prop 31, Hildy?
I was going to second that, but it sounds like it's already been
Yeah,
seconded.
it already got
I'll put
seconded.
my hand down.
Okay, very good.
Yes on upholds the law.
Yes, would uphold the ban that's currently in place.
Yes, vote.
Okay, very good. Moved and seconded. Let's just do a reverse roll call.
Any opposition? Any abstentions?
David, I will abstain.
Oh, Jennifer.
Any other changes from this staff recommendation?
Okay, so then the rest of the staff recommendation, is there a motion for the rest?
Actually, I would, I think it was, we didn't take any positions on 26 and 27.
No, we have a position on 26.
26, and then I wanted 27, which is I do think that there is a position we should take, and that would be no on that, because that's the online one. And that would in fact increase problems for our cities, because now we have kids that we're going to get on the internet, be able to do that. They're going to have, people have gambling addictions. The cities are going to have to pay for this there's not going to be enough money that they say they're providing with this proposition to deal with all the extra health costs that cities are going to have to undergo, and law enforcement to try to enforce this.
I think you're going to get yours.
Yeah, just second.
Second.
Okay.
They're gonna pay for the guy.
Any other comment on Prop 27? And
I'm just going to pile on with what B said. It's really the measure that keeps on giving in its negative externalities for local governments, the whole gamut of problems. So yeah, and I see Jeff says Cal Cities recommends a no position on Prop 27.
All right, so moved, seconded, and any.
Is this just Prop 27? This is
Yes.
reaffirming Prop 26 too?
Well,
Let's just talk about 27.
we were gonna-
26.
26
You can
already
bring up
has that.
26.
Well, the recommendation from the staff is to reaffirm the 26. So we're doing all of that. Yes.
This one's going to be just to oppose Prop 27.
That's
We'll do
correct.
Another motion. To
Okay.
All right.
The rest. Okay. Reverse roll call or just, oh yeah, sorry.
Yes.
Late. Any opposition to the motion to oppose Prop 27? Yeah. Any abstentions?
Abstention big time.
Abstain on all of these.
Okay.
Oh.
County offices.
And you two, and the first one you did too? I didn't see that. Okay.
Oh, okay. Sorry, I didn't catch that.
Wait, what?
Did you abstain on the first one?
No, the first one,
You were okay with
she
it?
voted yes on it in the state, in the assembly.
Okay.
I mean, in the Senate. So
Only this second.
I'm good for that one. I knew that one, so.
And I think the rest of the motion would include what you want.
26.
So any
They have whatever.
other of these, does anyone else want to discuss or oppose or approve any of the others? Okay, is there a motion to go along with staff recommendation on the remaining?
Yeah.
Moved and seconded.
Except 27 and 31. Yeah.
Right, that's what I, sorry, did the numbers. Okay, reverse roll call.
Any opposition? Any abstentions?
I'll stay on that one.
Yes, abstain.
All right.
Okay, thank you.
Next item.
Okay, the next item has to do with the housing trust. And we are waiting for the governor. I don't think he's done any housing legislation. Sounds like from what Jeff said about the parking is he's getting around to us, which of course makes sense since he only has till next Friday. But David and I have met and I've had a preliminary discussion with city managers about next steps. And we're planning, I'm really not ready to bring anything to you today, but I'm planning to bring like next steps to the next meeting, assuming that the governor signs their legislation. It seems very, very likely that he'll sign, but you know, why talk about it till we know, and we'll just wait another week. Yeah. Oh, by the way, 8 cities and SCAG have sent letters of support. So if your city has not sent a letter of support and you're interested, please do so. Okay. And I can tell you which cities if you want.
Okay, very good.
The next item on the agenda is ideas for the next session for legislation. We're going to start meeting with the legislative committee to talk about, we had several ideas for legislation. One, of course, we don't know what the budget's going to look like, but we might want to ask Ian for money for the housing trust. The second would be, we had asked for money for a sustainability center that would talk about working on solar initiatives and electric vehicle initiatives, things that the state is sort of mandating, but we don't have any funding to do it through our environmental services center. So we want to fine tune that request and talk to our legislators about creating sort of like another environmental services center. This would be about sustainability and really focusing on adaptation and the things that we need to do that are not funded, but we have to get them done. Those are the ideas that we've had so far. We would be very interested in the next month or so to get any other ideas for state legislation that we should ask for.
I like that idea. Any ideas now? And of course, we could also talk about it again at the steering committee and of course, the legislative subcommittee. But yes, Olivia.
So I'm going to be very interested in repealing Senate Bill 9 and 10, Proposition 19. So that's something I'd like for us to discuss.
Okay. Any other ideas? I don't see any hands up. All right, Jackie, next item.
Okay. The next item is Bronson, who has a lot to talk about with homeless services. Bronson has more hours in his day.
Yeah, I'll try to make it quick. It's already in your packet, so I won't go through the whole presentation. But I want to ask for your consent to go ask for more money, basically for Client Aid, which is a very successful program that we have in our innovation fund. And so wanted to just go through the performance results. Just a quick reminder, Client Aid pays for things the county and LAHSA don't pay for or don't pay for quick enough, like security deposits, application fees, motel stays, things like so after 13 months of this, it's a pilot program. So we didn't start off with a whole lot of money, but we spent roughly $30,500 so far. And we've dispersed this money to 27 clients. So on average, you spend a little over $1,000 per client, which is in the grand scheme of things, not a whole lot of money. Of the 27 clients, 19 have been permanently housed. 4 have progressed on their housing plan and are still actively looking for housing. And we only have 4 that hasn't really progressed at all or has kind of dropped out of the program. So that's a 70% success rate, which is better, like it's a phenomenal success rate compared to other LAHSA programs. And so that's why we think this program should graduate from the Innovation Fund and be its own kind of standalone program. In the PowerPoint, I go through some case studies. And I also compare it with the most comparable program that's out there, which is LAHSA. LAHSA's problem solving. We can approve a request same day. That takes like a week just to get the approval. And then another 2 to 4 weeks for our clients to get the money, which doesn't work. If you're a landlord that wants a security deposit, you can't wait 4 weeks for that security deposit. So we can do it a lot faster. We also have documentation requirements, but it's a lot less stringent than LAHSA problem solving. So there are a number of ways our program is a lot better. We think it could even potentially replace LAHSA problem solving as a program too. So that's something we want to talk to the county about. And just really quickly, we still have, even though it's a quick program to access the funds, we still have a lot of checks and balances. So we have strong fiduciary integrity on the program as well. And so the ask is for me to go to the county and our partners to see if we can get more sustainable funding for this program. We're asking for $350,000. And with that money, we can assist roughly 250 clients a year. And we're looking for also another headcount to help with administering that program. It's a pretty, that to administer that amount of money for the program, it's basically a full-time job.
And I think what we're asking for is that LAHSA currently has this problem solving, but they don't use it all. So we're not asking them to give us money that isn't there. We're asking them to give us part of the problem solving money they already have because we can get it out the door. We should probably make that clear in our request.
Yeah, there is underspend in these LAHSA programs. When I was at LAHSA, I saw it, millions of dollars of money unspent. And so what we want to do is tap into that money. So yeah, so that's.
That would be a motion. We'd ask for a motion on that.
Yeah, and actually, before we do the motion, maybe we can add, because I know many of these items the steering committee talks about,
Yes.
but the people that aren't at the steering committee, they don't realize that it's already been talked about. Maybe we can add to the agenda that it was steering committee approved by a certain vote in parentheses next to the one, so that the rest of the board can see that it's already been talked about.
Sure, I know it's.
That way they kind of know that there's a little momentum already building. Anyhow, is there a motion for helping Ronson seek? Move.
Second.
Moved and seconded. That was Rodney and Barry. Okay, reverse roll call.
Any opposition? Any abstentions? Okay, thank you.
Okay, and we probably will be asking our two Board of Supervisors officers to help us with this request, so.
Taking notes.
Okay, so Ronson is not done yet.
That's right here.
Ronson, you want to go?
Yeah, so the homeless count, I'm sure there was this eagerly awaited result that was released last week. We share the numbers for our cities so that you can see. So just the way the county's framing this, and I agree with it, is that if in 2020, if I were to tell you, for the next 2 years, there's going to be a global pandemic, businesses are going to close down, people are going to lose their jobs, how do you think homelessness is going to do? You probably say it'd probably go up like at least 20%, right? Well, it actually only increased 4% in LA County. And what happened is that, remember we had the eviction moratoriums, we had, COVID relief funds, we also had rental relief funds and Project Room Key. So all of that really helped. And a lot of money went to even our cities to open pallet shelters, housing navigators, as well as homeless court. That all came from COVID relief funding. So it was a group effort. It was a community effort, and we bended the curve, using a COVID term, on homelessness because of that. So 4.1%, even though it increased, to me that's a win considering what we had to deal with the crisis. Long Beach is considered part of SPA 8, so I had to carve that out because they actually, for some reason, their count went up a lot, 62%. And so I don't know what's going on there, but yeah, that's a big number. If we carve out Long Beach, the South Bay actually decreased 2.5% overall. You can see I broke out some of the LA city portions of the South Bay. San Pedro went down 29.2%. Councilmember Buscaino, he opened a couple of shelters during that time as well. So that helped. And then he's done some encampment cleanups, which has also helped as well. Wilmington went up, but other parts of the harbor area has gone down. And then some of our cities have gone down. We had a few outliers. Inglewood's gone up. We sometimes see this when cities go through economic growth. In 2011, Venice saw that type of growth. Google, Hulu, Snapchat all moved into Venice, and that displaced a lot of people. And so we saw a big spike in homelessness in Venice. Snapchat actually literally took over the same building as a homeless service provider. So they literally displaced, got more people into the streets. So we see, so it's kind of counterintuitive, but when your city's doing well and businesses are coming in, people are getting jobs in your city, that can displace people. So that's just something to be mindful of as you go on certain economic development efforts. But we had some really successful cities. Redondo Beach just won the League of Cities Award for their efforts on homelessness. And their numbers reflect that. It's gone down 44.1%. As a percentage, that's impressive, but even as a whole, they went from 177 to 99. So that was really good. So you can see the other numbers there.
Ronson, you have a lot to do, so go faster.
Okay. So I'll just say just a couple of bad things. I'm going to end on a bad note on this one, actually. So seniors went up 42.1%, and that is anecdotally, we're seeing that as well. So that's a problem. And there are storm clouds on the horizon. The eviction moratorium ends this year. So I think we might have punted some of this problem into 2023. So I'm very worried about that. So that's all I'll say on that so far. And then some other things, yeah, just really quickly. I just want to remind people, some cities, we have PLHA funding. Let me share. I just want to remind some cities that they have PLHA funding. And what that is it's funding for our cities. These cities, I think it's because they have CDBG money. So these cities, they have funding for PLHA, which is funding for, you can build affordable housing with that money. You can build shelters and you have homeless services. You can also have that money put into the housing trust fund. So I just want to remind these cities that you have money. And the reason I want to remind you, because there's a funding deadline of October 31st that's coming up to access those funds. If you miss that deadline, it's okay, because you can still access it next year, but there's a window to access it this year if you want.
And we have notified the city managers, right?
We sent it out in our task force meeting, but
We probably ought to send me something to notify the city manager.
yeah. So that's that. And then I think there's one more thing. Oh yeah, and then just actually two more things really quickly. There's a regional convening event that the LA County is putting on. They're inviting cities to attend it for the South Bay. It's a South Bay specific event. It's going to be October 20th. They want feedback. So out of the Blue Ribbon Commission, it was agreed upon that they would give cities more money. The pot that they're coming up with is about $10 million. And so they want feedback on how we think they should spend that money on our cities. And so that feedback session is on October 20th. And then one last thing, we're looking for winter shelters. The county is actually asking faith-based organizations if they are willing to do winter shelters. So we're monitoring that because there might be a shelter popping up in your city because one of your churches might be interested in it. So we'll let you know if we hear of anything like that happens. I just want to give you guys a heads up that that's happening as well.
Tried to reserve facilities.
Yeah. I mean, Oh, okay.
The reserve military places that aren't being used.
Oh, okay.
I'll try that.
Yeah, I know last year we had one in Alondra Park. So I think they want maybe like one or two more other options in the South Bay.
The other thing that is voter registration, the League of Women Voters, I think.
Oh, that's right.
Registering homeless people, and you can register homeless people. So please, if you have that opportunity to help someone get registered, please do so. So that's Ronson's report. Shall I go on? Jonathan couldn't be with us tonight, but we have the report on SCAG REAP, and I don't know if Wally's still here. Yeah, anyway, I do have Jonathan's report. We have 3 REAP projects. The first is the ADU acceleration project. We've actually sent out a survey. 738 postcards have gone out to people that either own or live in ADUs in El Segundo, Gardena, Hawthorne, Hermosa Beach, Manhattan Beach, Rancho Palos Verdes, Redondo Beach, and Rolling Hills. These are cities that volunteered to be part of this study. The first 500 survey takers will get a $10 gift card. And we were going to pay for the $10 gift card, but it turns out that our consultant had leftover gift cards from something else. And so this is at no cost to the COG that we're going to be giving these $10 gift cards. Very nice. So the initial results, and as of today, I mean, they just went out, but we've gotten 31 responses, which is 5%. And 24 were owners and 7 were renters. 22 people did claim the gift card. And the initial findings, which is very interesting, is that only half of the ADUs are rented. So we're going to obviously have much more to talk about with this. There is a detailed narrative because there were open-ended questions, and we'll be bringing a lot of that back to you.
So the other half are not vacant, but people just don't pay rent.
Yeah, and I'm not even sure, I don't know if Wally knows this, but I'm not even sure. Yeah, if they either found, or they could even be in office. I mean, it could be used for something else.
The worry our city has is people are claiming ADUs, but then they have their gyms out there.
Yeah, and I don't know if we're going to pick that up in this survey, because I don't know if people will say that, but we'll see.
I'm pretty sure people wouldn't admit to that.
Of course.
So, so the outreach has been, we've been trying to make it extensive, but we've asked cities to also help us with this. So we've sent a caption and infographic to cities and asked those cities to put them on their website. And I think Hermosa Beach has shared the information. I'm not sure about the other cities. And then we're also doing a housing policy comparison of those different cities and their different policies on ADUs. And 7 of the 8 cities have had their interviews completed. And then we've also, if you look at the South Bay Watch, our newsletter, this summer edition has a cover story on this project. And we've had articles in the Daily Breeze and the Long Beach Press Telegram. So that's that project, which is moving along. Our second project is the commercial redevelopment into housing. And we're looking at feasibility criteria. Studio 111, our consultant, has created criteria to identify underperforming commercial segments in the 6 participating cities. The 6 cities in this project are Carson, El Segundo, Hawthorne, Hermosa Beach, Manhattan Beach, and Redondo Beach. And preliminary locations are being mapped for each city. The consultant is working on aligning potential redevelopment areas with our fiber network and our local travel network. So we coordinate all that. And we've connected each city to discuss the findings and narrow down the sites. They can't study everything. Also, there was a webinar, I guess Wally attended something today on something that SCAG funded called the Other to Residential Toolkit. You'll hear a lot more about it. We're going to be, he was incredibly impressed with it. He was telling me today. But we are also presenting at SCAG on how we're going to be using it next Tuesday, I think. So they've invited us to come and present on how this fits into our study. The last project on REAP 1 is our 10-unit curriculum for housing. And we discussed that at a meeting with the community development directors on September 15th. We got additional comments and we're going to refine the curriculum. And then we're going to have another and probably last advisory committee coming up soon. And then I think we have to plan a schedule and invite speakers and have these meetings. They're for your planning commissions, they're for your city councils, your staff, people that really want to understand where a lot of these things come from. What is RENA? Where did it come from? What are developers? What's their side of the story? As much as we can, we're trying to give you the whole picture. REAP 2 is coming along. REAP 2 is the second phase of SCAG funding. We're going to be getting, and it's based on your RENA numbers, so we're going to be getting $585,856. And we have to do outreach right now to cities. What we're planning to do, we have to, by October 14th, we have to say we intend to apply. And we do intend to apply. And we can be reimbursed right now for the work we're doing. It's very confusing because we have no contract with SCAD, but they say we can be reimbursed right now. So for the outreach that we're doing to prepare for October 14th. The money will not even be, we can't even apply for the money for an actual project until at least February. A lot of this is being driven by HCD, which they keep changing their mind on things. The one thing we absolutely know will qualify, because SCAG has told us this, is the formation of the housing trust. So, you know, if no other money comes in, the SCAG REAP 2 money is there for the housing trust. And we can, it won't cost $585,000. So we've got money to do that. And we're looking at other possible other projects that we can apply for to use that money. But it won't be, I think personally, it will not be available until the next fiscal year, the way they're going. Okay, we only have a few more items left. Kim is going to talk about the South Bay Environmental Services Report. Kim?
Yes, and you can go to the next slide. We've been very, very busy. And so the first item here is on water. We do have several rain barrel giveaways coming up, even though we don't have a lot of rain, but this gives really an opportunity to educate to educate the community about
program. You have to believe.
You put it out there, it will come.
That's right. That's right. But it does give us the opportunity to educate people on saving water and how they can use, a lot of times people put like buckets in their shower and then they can use that to water their gardens and things like that. So it does give us an opportunity to engage the community. And as you can see here, we have already over 1,000 people that have registered for these rain barrel events. It's a huge number of rain barrels that are going to be out. the first event is this weekend, and the team's all ready for that. Next slide. I just actually came back from the California Climate and Energy Forum, and this is an annual forum. This is the first time we've been in person since the pandemic, and I actually spoke on a panel breaking through regional barriers for energy action. We had about 33 people there, and I was able to really highlight about the South Bay. This is a statewide forum, so we have agencies from up and down the state, as well as legislators and utilities are in attendance there. And what was interesting about the forum itself is there was a lot of discussion on decarbonization. They're actually calling natural gas now fossil gas. They don't want to use the word natural anymore. And how to move to, electrification. So not only with vehicles, but with buildings. And then there was a lot of talk then about grid reliability, like how are you going to meet these goals? And it was interesting. We did have very high level people in attendance. We had the CEC director or chair. We had one of the CPC commissioners. She's actually responsible for energy efficiency. We had the director of OPR, that's the Governor's Office of Planning and Research. And then we did have SCG, that's the Strategic Growth Council executive director also. And we were really trying to get some specifics from them on what are you going to fund? How are you going to provide programs? There's a lot of discussion from this group specifically on state goals, and not a lot of specifics, but at least I think that they heard that we need real solutions. We need real financial and expertise resources for our communities. And so then that's really the last piece here is like, what can these agencies provide, agency resources? And then the other thing that I love about these conferences is it really gives us an opportunity to network, primarily to identify funding sources and to talk about joint projects, one of which we've been talking to LA County potentially to submit a grant. It's a block grant similar to what was done several years ago, where cities actually were able to start their energy efficiency programs. And there's another potential that we could work with them. It's a federal grant. The COG is not cannot take federal funds, and so this would be a great partnership. Next slide. And then we've been doing a lot of community events, virtual and in person. And two of them I want to highlight for you is we just had this for the city of El Segundo, and this one was a hybrid event. We had very low attendance in person and virtually, but they televised it and they replayed it. And so now we have over 32. It's only been out there for a couple of days. We have 32 views already on this presentation. What's really great about this is this was a partnership between the SoCal REN, so we talked about energy conservation, but also we brought in West Basin, which everybody wants to know about water. The city of El Segundo has a environmental committee that's made up of the community, and we had several people there from that committee talking about how they were implementing different kinds of programs, and some of those were gray water, for example, use, and I thought that was really interesting. They were very excited about it. And then we have one coming up in the city of Hermosa Beach, and this is going to be a virtual event. It's going to be on October 12th, and we're promoting that to the general public. And just to remind you, we are out in the community, out in your communities all the time. We do about 100 events a year, virtual and in person. And so we do have all of those posted on our website. And Colleen is actually tweeting out whenever we're going to have staff an event. Colleen actually tweets it out on our social media. So that's all I have.
All right, thank you.
Okay, next item.
I wonder if I might, under this topic of environmental services and our concern about the climate and so forth, just mention that we've gotten a lot of feedback from the Daily Breeze article on the substantial emissions, lead emissions from the gasoline in small planes, and the fact that the Torrance Airport is like #2 in the nation in lead emissions. And seems like a subject that rather than it being a city issue, it really is a South Bay issue because we're all impacted by, who goes in and out of that Torrance Airport. To either have, a speaker on it or some kind of research or something that we could maybe address the issue if people are interested.
Bring that one up to the steering committee and then we'll add it to the agenda through board.
Yeah, I guess the question is whether anybody else is interested in that.
Yes, I would be interested.
Okay.
Okay, get back to you. We only have about 3 more items or 4 more items. The South Bay Fiber Network, we're working still on the wireless. I already mentioned to you, we're looking at new sites. We have a couple of sites that we're pricing out so we can see what we can use our remaining money there. And we have a committee that we formed to discuss applications and to see if we can help cities with some using the network to create its potential in each of our cities and as a network. I will go on to the local travel network. We had a great charrette today with a good attendance. The charrette was to design the signage for the local travel network. And we have 3 designs that are being developed. It was really fun because the graphic artist was there and somebody would say, well, can you change the colors to what? And the font to this. So we got to play with all these things. And so they're going to refine what we discussed today. And we're going to get ready to bring 3 designs to the board. One of the things we might discuss at the steering committee is what will make you feel comfortable voting. We can't have, I don't know how many, 75 to 100 elected officials all voting on this in each of your cities. But what do you want us to give you so that you can vote, again, on behalf of your city, I guess. So this is something we're discussing because we want the COG board to vote on this. And then that will be the signage for the local travel network.
I would just say that for me, I would rather bring something back to my full council because it's going to affect my city and people in my city are very sensitive to lots of signs and obstructions. So it needs to have a look and feel that they're going to be, and I'm sure that my fellow council members feel the same way. So that's probably the process that, maybe the subcommittee or whoever that's working comes up with.
Well, maybe we don't do 3, but we actually try to come up with a recommendation that we market to the cities because it'll be it could be crazy if we give everybody.
Maybe you have a recommendation that you bring to, and then we can bring back to our council and come back.
Maybe that's how we should do it. Okay, this just came up today, but it's really a very interesting exercise, and I think it'll be. They did some good work on senior services. I'll let Ronson and Britt talk about that. We have a very exciting guest coming to our senior services meeting next Tuesday morning.
Yes, that's Tuesday, the 27th at 9:30. It's continue to meet by Zoom, so anybody can check the staff to get the link sent to you. We're going to have Helen Dennis, who is a syndicated columnist on senior issues, is going to be telling us a little bit about trends and aging issues. And she has a regular Sunday column in the Daily Breeze. Some of you may look at that. Then we're also going to have hear about Gardena and Carson senior programs. And I think you have a little bit more on the
About
ARP.
Gardena and Assemblyman Marisucci will.
I wanted to say that this is so interesting. Assemblyman Marisucci came to our homeless services committee and we put him on the beginning because we wanted to be respectful, and he stayed for the entire meeting. He's coming again to the senior services and he wants to talk about legislation. And I just think that we've never had an assemblyman who was coming to our meetings and staying and really participating. But he will be at the senior services committee meeting and we're delighted.
Do you think we should move him up front?
No, what happened is I got asked that question and I asked the staff to check with his staff. If he's planning to stay for the whole meeting, then we don't need to move him.
Okay. So we could just put him under the legislature.
Right. But we're asking him because we want to respect his time.
He's actually coming to our senior event Saturday to give us a check.
Really? It's really, I mean, he's really showing an interest in the groundwork that we're doing. I have one last item, but before we get to that last item, I just want to make this announcement. All dues have been paid for 22-23. We got our last check today. And so, which is really great because for those of you that don't know it, if you don't get a check by September 30th, then they can't vote, or the delegate cannot vote. So we've been really pushing the last few to come in. So they're done. Okay, the last item I wanted to bring before announcements is Colleen. Colleen's going to talk to you about, it's already time to think about another photo contest. So Colleen?
Yeah, so as some of you may recall, last year we had the Why I Love the South Bay Photo Contest, first annual in January. It kicked off, and then we announced and selected the final winner at the GA. And so it was a great way to get the to raise our profile in the community, and we had coverage in the Daily Breeze and 150 entries. But the downside was we got a lot of coastal shots, predominantly.
Only coastal shots.
What's wrong with that?
Few that weren't, but yeah, mostly. So we wanted to revamp it a little bit and do it again. And we were trying to come up with some theme ideas that might draw some of a more variety of shots or different shots. So the three that we came up with were South Bay landmarks, which could introduce some interesting photos. Also community events, which would allow people to send photos of people, and then city buildings. And so when I asked David to set up a poll, I know some of you won't be able to take it there that are in the office, but if you could email me after the meeting what your choice is, and if you have any other ideas, that would be greatly appreciated. And then if you, David, if you could keep the poll
I
up.
guess I'm, hold on. I guess I'm logged in on another computer on the Zoom.
Okay.
And it's not letting me share the poll for that reason. So if you want to share your thoughts in the chat, we'll collect them that way. And then, oh, there we go. Oh, Natalie was able to do it. There we go. Thank you, Natalie.
So once again, the ideas we had were South Bay landmarks, community events, and city buildings. And of course, if you have any other suggestions, please put them in the chat.
Coastal views.
Computer on
No
Zoom,
coastal views.
share that way. Otherwise, let me know and I'll jot them down by hand.
Okay.
You want to just
So they're eliminating.
let's pass it around?
Oh, my happy place. That'll be the ocean now.
You want us to write them down and give them?
Actually, use the sign-in sheet.
Yeah, let me,
All right.
use a sign sheet for the folks that are here and write your thoughts down.
Wait, what are the options? Oh, landmark.
South Bay landmarks, community events, and city buildings,
Or anything
other,
else.
something else that you have.
But it was fascinating.
Would the ocean be a landmark in the South?
Well, it could be, but we only got ocean. It was like, that was the only. So we're trying to figure out something.
Coyotes, I heard that.
That's really the reason why people love
Yeah, a lot of those.
Okay, so
Favorite
thank you,
wildlife.
Colleen. Thank you. So if everybody,
Are people voting online?
are you guys voting online?
Make sure to vote online.
So look, we have one voter here.
Steve, you vote?
Yeah, I sent one in.
Oh, right on.
Okay.
Thank
Okay.
you.
We're down to agency reports and upcoming events. I just wanted to reiterate, that I sent you all something that we've been invited. We have 10 tickets for Monday night in Hollywood for the Asian Pacific American Leadership Foundation to do a screening of a documentary with a lot of elected officials invited. So if you're interested, ask me and I can send you the invitation. But I just want to make sure you all saw that. That's all I've got, Mr. Chair.
Okay, very good. Once you had at the end, that announcement. Okay, agency reports.
Unless.
Is there anyone
Jeff has more
here?
to say.
Jeff, do you want to add any more tonight?
Oh.
I think I mentioned earlier, but just there were obviously the Care Court bill was signed. And then AB 1951 was vetoed. That was the manufacturing tax credit that would have swept up sales tax for local agencies, including their add-ons. So we were very excited that that one was vetoed. And I think that's all I have. I'm happy to answer any questions though.
Any questions for Jeff?
I think you said 2097 passed. What was that?
Yeah, 2097 was the Friedman bill that did parking, no parking limits within a half mile of transit. That's right. Yeah. So that was signed just this evening by the governor.
Some additional information from the guys.
So you mean 2097?
2097. I see.
Correct.
You want to add that?
Yes.
Okay, Bea, go ahead.
Okay, I just want to add upcoming to our legislative committee report, which every member is invited, even though you won't have a vote, but our board on the 28th, so that's next Wednesday, we're going to be taking up whether we send a comment letter to the LA County Board of Supervisors regarding their LA County Land Bank pilot program. Just so those of you who may not know, apparently the Board of Supervisors did vote in March 2022 to direct the CEO's office in collaboration with county county offices to explore land banking models that would operate on a regional scale to support affordable housing preservation and production, particularly in areas where there's communities at risk for displacement, where there's large infrastructure projects. And the Metro Board passed a similar motion in June. However, there was, I would say it is not any staff member from our Board of Supervisors that are here present, but some other supervisor, their staff member indicated that under this county land bank program, they would not be subject to the land use regulations and zoning requirements of local jurisdictions, which is obviously a concern, so that it would, because this program would propose to facilitate construction of affordable housing within the jurisdictional boundaries of incorporated municipalities, regardless of existing land use regulations that are required by the city. So we're going to be taking that up on the 28th. I wanted you all to be aware of it because you need to be informing. And we don't know when it's going to be coming up on the Board of Supervisors agenda, but obviously that's a concern.
It would be good if maybe you can get an email out to the group so that they can better research and focus on it before the 28th.
Yeah, I can send a copy. I think it's okay, Jeff, for me to send a copy of our agenda, right? Yeah.
I think that would be fine.
Okay.
Okay, so thank you, Bea. Any other agency reports? I don't see anyone else popping forward. Should we go to upcoming events and announcements?
The only one I had was that Asian Pacific one.
Okay, oh, right, thank you. Did you want to mention again your event or is it too late?
I'm just one more time, there is an event, City of Gardena. It sponsors the seniors. It's cigar, wine, whiskey, and entertainment. And I'm going to tell you right now, I have a couple of extra tickets. If you want to come on Saturday, just give me a call and I'll meet you at the gate.
There you go.
What a guy. Such a deal.
That's it.
That's good sound.
Ardina. All right, any other announcements from anyone?
The City of Carson is having the annual Jazz Festival October the 1st at Anderson Park from 11 a.m. until 6 p.m.
Oh, fun. Thanks, Cedric. All right. Anyone else? Oh, yes, Aurelio.
Since it's a public meeting, we are having a transportation committee meeting on Wednesday night at the chamber, the city council chambers scheduled from 6 p.m. to 7:30 p.m. That's Wednesday night, September 28th. And of course, the big discussion there is the C line or Green Line extension. So Torrance is taking a position on that. So I invite anyone that wants to attend. I think it would be nice to at least listen to some of the reports that are coming out.
Send us?
Sorry?
Is there a flyer that you could send us?
Don't have a flyer, but I can see if staff can put.
Yeah, they could put something in, I'll send it out, yeah.
Absolutely.
We should send it to the Metro Service Council too.
Yeah, they moved it to the downstairs chamber because we expect a lot of people to show up.
Okay, great. Well, given it's 11 after 8, I thought I was going to do a lot worse, like it was going to be 10 o'clock when we got finished. So I'm really glad it's only 8.
Ordering pizza.
11. So with that, we'll adjourn till Thursday, October 27th. Have a great rest of your month, and the meeting's adjourned.
Good night, everybody.
Bye-bye. Good night.
Y'all come back now here.
All
Next month.
right, B. All right.
Conversation.